Remember to subscribe and don't forget to hit the bell icon to never miss an update from Brainy Gang. Breastfeeding is a skill that requires time and patience to learn. With practice, both mother and baby will become more comfortable and confident in their breastfeeding techniques. It's important to experiment with different positions to find what works best in different situations. Today, we are going to discuss different types of breastfeeding positions. When choosing a breastfeeding position, keep the following tips in mind. Prepare beforehand by gathering everything you need, such as drinks, snacks, your phone, TV remote, book or magazine, and don't forget to use the bathroom. As you may not be able to get up for a while, make sure your baby is comfortable and secure. The position you choose should allow the baby to be supported and stable without twisting their head, neck, or spine. Ensure your own comfort by using cushions, pillows, or rolled towels to support your back or arms if needed. Let's see them one by one. Number 1. Cross Cradle Hold. Cross Cradle Hold is ideal for newborns and younger infants. The cross cradle position can be helpful for mothers who are trying to establish a good latch, or for mothers who have large breasts, as it provides good access to the breast. Find a comfortable chair to sit in. Place a pillow on your lap for added comfort and support. Pick up your baby and place them in the crook of your arm, with their head resting on your shoulder. Make sure their bottom is supported by the pillow on your lap. Use your free hand to support the baby's head and neck, making sure their airway is clear. With your other hand, hold the baby's bottom and bring them closer to your chest. Number 2. Reclining Position. Reclining position is a commonly recommended position for breastfeeding, as it provides comfort and relaxation for both the mother and the baby. In this position, the mother lies back while propping up the baby's head and upper body with pillows, allowing the baby to breastfeed in a relaxed, upright position. The reclining position can help reduce neck and back strain, and can also allow the mother to use gravity to her advantage, making it easier for the baby to latch on. This position can be helpful for mothers who have difficulty with milk flow or who have had a cesarean section. Number 3. Football Hold. The football hold position is a popular breastfeeding position where the baby is positioned with their legs tucked under the arm on the same side as the breast they are nursing from. This position is called the football hold because the baby's position is similar to a football tucked under the arm. This position can be a good choice for mothers who are breastfeeding premature or small infants, as it provides extra support for the baby's head and neck. This can be helpful for mothers who have large breasts, as it allows for better access to the breast, and can also be useful for mothers who have had a cesarean section, as it places less pressure on the abdominal area. Number 4. The laid back position, also known as the biological nurturing position, is a breastfeeding position where the mother is reclined with her body supported by pillows, while the baby is positioned facing her with its body supported by the mother's chest and tummy. In this position, the baby is able to breastfeed in a relaxed, upright position, allowing for a deep latch and effective milk transfer. The laid-back position is believed to stimulate the release of hormones that promote milk flow, and can also help reduce tension in the mother's neck, back, and arms. Number 5. Side-lying Position. In this position, where the mother and baby both lie on their sides, facing each other, the baby can easily latch onto the breast and nurse comfortably. This position can be particularly helpful for mothers who are recovering from a cesarean section or who have back or neck pain, as it places less strain on these areas compared to sitting up. Additionally, the side-lying position can be a good choice for nighttime breastfeeding, as it allows both the mother and the baby to rest while they nurse. Number 6. Cradle Hold Position. The cradle hold position is a common breastfeeding position where the mother cradles the baby in one arm and supports the baby's head and neck with the other hand. In this position, the baby is positioned facing the mother, with its body supported along the mother's forearm. The cradle hold position is often used for the first few weeks of breastfeeding, as it provides good access to the breast and can be helpful for mothers who are trying to establish a good latch. Number 7. Upright Position. In this position, where the mother sits upright while holding the baby in a position that allows the baby to breastfeed comfortably. In this position, the baby is typically positioned facing the mother, with its body supported along the mother's forearm or across her lap. The upright position is a common choice for breastfeeding and can be helpful for mothers who have had a cesarean section. The upright position can be useful for mothers who are experiencing engorgement or overfull breasts, as it can help with milk flow. Number 8. Nursing in a sling. In this position, the baby is positioned facing the mother, with its body supported by the sling while it nurses. A baby sling is a type of carrier that holds the baby close to the mother's body, allowing for easy access to the breast for breastfeeding. Nursing in a sling can be convenient for mothers who need to be mobile while breastfeeding, as it allows them to keep their hands free and have their baby close by. Additionally, nursing in a sling can help create a sense of intimacy and closeness between the mother and the baby, which can be important for establishing a strong breastfeeding relationship. However, it's important to make sure that the baby is positioned safely and securely in the sling and can breathe easily. Number 9. Twin feeding position. In the twin feeding position, the mother holds one baby in each arm, with each baby positioned facing the mother and breastfeeding at the same time. This position can be helpful for mothers of multiples, as it allows both babies to be fed simultaneously, saving time and reducing the amount of physical strain on the mother. What's your preferred breastfeeding position? Please share in the comments section. Proper positioning is crucial for successful breastfeeding. Incorrect positioning can lead to discomfort and sore nipples, as well as difficulties for the baby in obtaining a full latch, hindering proper milk flow. This can result in a decline in milk supply. To ensure comfort for both mother and baby, it is important to position the baby in a manner that allows for a deep latch and proper stimulation of the breast. If you're experiencing difficulty latching or discomfort, seek assistance from a lactation consultant or breastfeeding specialist. They can help you and your baby find a more comfortable feeding position. Thanks for watching, and don't forget to hit that subscribe button and turn on notifications so you don't miss new videos.